In this video, 9 tips that will help you ace your game of pharmacology. Let's dive right in. My tip number 1 is to buy the correct books. Well, every university has their own version of their favorite books, okay? You can ask your seniors, your college professors of which are the recommended books to buy. But my personal favorite are K.D. Tripathi, very beautiful pharmacology textbook. Then there's Katzung and there's Lippincott publication. You can buy any of these. As a student who's just starting pharmacology, it is very tempting to buy a shortcut book, or maybe at the other extreme buys the most exhaustive book like Goodman-Gilman. I don't recommend either. The shortcut book has very less information in it, and it will literally make your journey of learning cut short. You will get disheartened because you know so little. And whereas books like Goodman-Gilman will overwhelm you with too much of information. So try to get a standard book, right? Second is to choose and start studying any section in pharmacology except general pharmacology. Yes, I know it sounds counterintuitive, but you heard me right. It's like buying a video game and then sitting and reading a user's manual. That's not what we do, right? We buy a game and we understand the game as we go through it. Think of your pharmacology as a game to be played. And as you play that game of pharmacology, when you study the renal pharmacology, the pharmacology of autonomic nervous system, you will eventually get a hang of the various drugs, their mechanism of action, and terms like pharmacodynamics, kinetics, routes of administration. That will come later. Trust me, practical aspects trumps boring theory every single time. And you will thank me later for this point. My third suggestion, of course, is to start with the end in mind. Now, when you pick up a textbook of pharmacology, and let's say you're starting with renal pharmacology, why did you start studying it? Because you want to treat patients. What kind of patients do you want to treat? Flip to the uses part, right? And you will realize, I use diuretics because it gets rid of edema. So now we reverse engineer. Why did a patient have edema? What is the physiology? What is the pathology behind edema? So now you have understood the mechanism of the disease. Let's understand the mechanism of action of the drug. Getting it? Then you will understand that the drug is just one prototype drug that you have studied. There are many more in that chapter. So now you will by heart the classification. And once you're done with the classification, you will understand that, I need to compare these drugs with each other. And then, of course, you will do the uses one more time. See, we made a blueprint, a go-to list. So when I'm going to study this chapter, I need to do pathology, physiology, the prototype drug, the classification, the uses, the mechanism, stuff like that. My fourth tip is to subscribe to good YouTube pharmacology channel. Well, in today's age of internet, there are so many things that are available for free. There are awesome study resources available on the web. You can subscribe to my channel, hit the like button, share this video with your friends, and when we post new videos, you will get notified about it. There are many other YouTube channels which you can subscribe to. Okay, whoever connects with you, awesome. There are websites that give you how to write answers, mechanisms, diagrams, flowcharts, you name it, and it's available for free on the internet nowadays. My tip number 5 is recap on your basics, on your physiology and pathology. It's like you want to build a majestic palace of pharmacology, you need to have a rock solid foundation, and physiology and pathology are those foundations. Okay, if your physiology and pathology isn't good, your pharmacology will not survive for too long. Okay, I'll give you an example. Renal pharmac. If you don't understand the countercurrent mechanism, you can't understand the action of drugs like furosemide and toracimide and bumetanide. But if you know that, the drug mechanisms become so easy. Once you understand the mechanism of diseases, treatment becomes easier to understand. Tip number 6 is to nail the prototype drugs. You heard it. Squeeze out all the information about that one prototype drugs from that unit, that chapter. Literally go in depth Study that prototype drug as if your life depends on it, including the mechanism of action, the uses, the contraindications, the side effects, the adverse drug reactions, the pharmacokinetics, the interactions, everything that you can find about that prototype drug. Just do it. That itself will give you tremendous confidence about that unit. Simple. Tip number 7, classify. Every chapter that you will open will have its own drug classification. And this classification is usually based on either mechanism of action of the drug or receptors. So basically, when you study the classification, you might automatically understand the mechanism, the receptors on it which works. Sometimes the classification is based on older drugs versus newer drugs. That also will help you in understanding what is the latest drug in the market, why was the old drug eliminated from the market. That is something that you can look. Pharmacology has a lot of drugs, lots of them, and memorizing the classification is the easiest way to understand the relevant grouping of drugs in that chapter. 8th tip. Once you're done with the classification and the prototype drug, now is the time to compare and contrast. The prototype drug was the representative drug of that particular topic, of that particular class of medications. Getting it? Once you understand the prototype drug, all you need to do is compare the prototype drugs with the other drugs. Oh, this drug is different in what aspect with regards to the prototype drug. And once you do that comparison, things become very, very simple. Like, trust me, once your prototype is done, everything else in the chapter automatically becomes a comparison and it becomes easier. Tip number 9, make your own notes. Perfect notes is the biggest lie anybody can tell you. Your notes are a work in progress. You have to keep adding points. If you buy a textbook like KD Tripathi and once you finish reading it and making notes out of it, somebody else in your lecture, your professor might tell you an additional point that not given in KD Tripathi. Where will you write it? In your notes. Your friend tells, oh, I read that Lippincott book. It has this extra point about so-and-so drug. You will add it in your book, right? In your notes. Then you might have MCQ books that you're solving. So many information will keep on pouring into your life. Where are you going to add it? In your notes. Your notes are going to look shabby and it is okay. If they are your notes, make the way you like it. I like a technique called as Cornell note-taking technique. I will share that strategy in another video. If you like it, you can use it. But your notes are just for you, nobody else. Feel free to create your own methodology. So there you have it. Exactly how to study medical pharmacology in 9 simple steps. Follow every single one of them and you will be really, really successful. And since you have reached to the end of the video, why don't you click the button that you see up and go to my next video, which should help you in understanding pharmacology a little more, and help you in simplifying pharmacology a little more. Till the next time we meet, this is Dr. Avinash signing off for now. Take care, keep studying and keep rocking. Bye-bye.